Hi, this is Dr. Divakar Bhat, cardiothoracic and vascular surgeon working at Aster RV Hospital, JP Nagar, Bangalore. Today I'll explain about grafting, various types of grafts we used because the commonest operation as a cardiac surgeon we do is coronary artery bypass grafting. So many patients and attenders and family members ask me, sir, what is this graft? What is this grafting, arterial, venous? So they totally get confused and they would like to know more about this. So the graft word means nothing but it is moving one tissue from one place to other place. In the trees also it is done, you would have heard grafting. Same way we do in the body. There are various words used: autografting, allograft, xenograft, all those things. Basically, moving living tissue from one place to another place in the same body is called as graft. That procedure we attach from one pipe to another pipe is called as grafting. So, in our human body, as I told, the commonest operation a cardiac surgeon does on the heart is coronary artery bypass grafting. These coronary arteries are tiny pipes which supplies the blood to the cardiac muscles or heart muscles. So, whenever this gets disease, that is the commonest disease, and the commonest modality of treatment is medicines. When medicine fails, we do angioplasty or various interventions inside. When all these things fails, we have to use alternate pipes. It's a very simple principle in this process. We don't do anything to the block, we don't remove the block. Instead, we create alternate pipes. So these pipes are taken from our own body. God has kept enough materials inside our body, like spare parts in our vehicles. The same way God has kept enough spare pipes in our body. Probably He knows this might be required in a person in future when these tiny important pipes gets blocked. So for these conduits or pipes or grafts, whatever we tell now, there are two broadly divided: arterial and venous. The arterial grafts are the one which we take it from internal mammary artery or radial artery or gastroepiploic artery. Venous are the one we take it from the leg or the thigh. The arterial means artery is one which gives blood supply to the pipe which gives blood supply to various parts of the body. They are little thick walled and elastic and they can sustain higher pressure. Whereas venous pipes are meant for returning the blood back to the heart. So they are thin walled and they cannot sustain higher pressure. They are low pressure pipes. So naturally the preference is to use arterial graft. The problem with arterial graft is the harvesting or removal of those pipes are very difficult for any surgeon, and they are spasm prone because whenever we sort of handle those pipes, they can become small, and attaching those or grafting that procedure is technically little difficult. Whereas vein is very user friendly and anybody can harvest the vein. And for harvesting this arterial and venous graft in Aster RV hospital, we have a special technique called Endo radial or endo venous. Normally, many places we do a long cut and take out the entire pipe, whereas in now the new technology is called endo radial harvesting. We make a small hole and use a telescope and remove the entire pipe. The same way we can do it on the thigh, that is called endo venous harvesting. This is how we harvest the pipes, either vein or arterial. So as I told, arterial graft should be given more preference, though technically it is difficult, though it takes more timing. The beauty of these pipes, arterial graft, is longevity is high. They work longer, the result speaks. So whenever a cardiac surgeon does a beating heart and total arterial grafting, the result speaks. So though the patient has undergone a major operation and suffered maybe a week or 10 days, some chest discomfort because of the operation, all those things, the same patient comes to me after 10-15 years and tells me with a smiling face because of the results. That's why this is one of the commonest operation done excellently and has shown over and over time tested excellent results. That's why many times we tell the patient, you have so many blocks, medicines don't work, angioplasty or interventions not possible, this is the last option for you. In reality, we tell like that, but many lucky patients we give this as a first option because we have seen the excellent results because of this procedure. As I told, this grafting, arterial grafting, which are from your own body, the pipes are of the same size, the pipes nature is same, and the new pipes which we place can increase in size according to the demand. That's why all my patient comes and tells me, though it was a little discomfort for few days when he is in the operation theater and in the recovery period, subsequently they enjoy a quality life, pain free life, and they come and tell me and thanks, convey their thanks, their family members. So please visit Aster RV hospital if you need arterial grafting, total arterial grafting, beating heart, without going on pump. We are pioneers in that, and we have produced excellent results over several decades. Please contact us if you have any hesitation. Thank you.